Hello and welcome everyone to this session on Conceptual Anesthesia app. My name is Dr. Jhanvi and today we are going to be discussing about benzodiazepines in detail. So this was one of the important topics of pharmacology that we were supposed to cover in our pharmac subsection, and today I'm going to focus on this. And benzodiazepines, as all of us know, is very important in our daily routine because we use it for procedural sedation when you want to go for short procedures like bronchoscopy, children for CT, MRI, or when you even want to give a little bit of benzodiazepine prior to surgery as an anti-anxiety pre-medication, or even to reduce the other doses of opioids or your induction agents during the induction of anesthesia. Post-operatively, when patients are behaving so rowdy in the post-op room, at that point, if they are agitated, you give them midazolam to calm them down. So very important topic of benzodiazepines. So let's discuss it in detail. All right. So first of all, we have to discuss about what are these drugs or the class of drugs that we are going to discuss today. And the class of drugs that we will be discussing is called as sedative hypnotic. Okay. Now, what is the meaning of sedative? Sedative is to make you drowsy. So over a period of time, after 5 to 10 minutes of listening to me, you will start becoming drowsy. So that is a sedative. Okay. And what does hypnotic mean? Hypnotic means from drowsy, you go off to sleep. All right. So after 1 hour of this lecture is over, you will end up in this state. Okay. So I start sedating you with this lecture and then finally I end up hypnotizing you. And these are the class of drugs that we are going to discuss today. Now, before we begin, I want to discuss with you that we will be comparing two very important classes of drugs that we commonly use over here. And why am I going to compare both of them is because the comparison is often asked in your exam. All right. So these two classes of drugs which belong to sedatives and hypnotics are barbiturates and benzodiazepines. Now, when we talk about barbiturates, we immediately think about the important barbiturate that we commonly use, that is thiopentone. Okay. So in barbiturates, commonly nowadays we use only two of them, phenobarbital for anti-epilepsy, and we use thiopentone as an anesthetic agent. All right. So what is relevant to us is the thiopentone. When we talk about benzodiazepines, the commonly used benzodiazepines that we have are midazolam, and nowadays the new one that has come is remimazolam. Okay. Other than that, lorazepam, diazepam, all these are not used much in anesthesia, but they all do belong to the class of drugs of benzodiazepines. So we will be touching a little bit on them too. All right. Now, all these drugs put the patient off to sleep. So what are they doing is, you have to remember that their target site of action. Target site of action of these drugs is going to be the brain. All right. And what do they exactly do to the brain? They have to inhibit the brain. Now, whenever we talk about inhibition of the brain, we have to also talk about the neurotransmitters that are important for doing this. Okay. So in our brain, we have two types of neurotransmitters. One are the excitatory and one are the inhibitory neurotransmitters. Okay. In the excitatory neurotransmitters, we have glutamate and we have NMDA. And in the inhibitory neurotransmitters, we have GABA and we have glycine. Now, whenever we talk about our sedative hypnotic drugs, barbiturates and benzodiazepines, you have to focus on one of these neurotransmitters, and that is GABA neurotransmitter. Okay. Now, let's have a look at the GABA A receptor that is present in the brain. Now, this GABA A receptor is present in many places. It is present in the amygdala, it is present in the pons, it is present in the medulla. So, when our drug goes, it goes and it will bind to this GABA A receptor wherever it is present in the brain. All right. So, how does GABA actually act on the brain? That is the basic that we will study from this slide. All right. So, what I want you to focus on is, this is the GABA A receptor, and it has different subunits, alpha, beta, gamma. You don't have to worry about that right now. What you have to worry about is, on the GABA A receptor, I have three sites. One is for the attachment of GABA. One is for the attachment of the benzodiazepines. Yes, we have a place or a site where the benzodiazepines attach on the GABA receptor. Okay. And we have one more site, which is the site of attachment of the barbiturates on the GABA receptors. Okay, so very basic, GABA receptor, and on this we have three sites of attachment, one for the GABA neurotransmitter, one for the benzodiazepines, one for the barbiturates. Okay, now let's see what happens when GABA attaches to the receptor. So GABA neurotransmitter, when it goes and attaches to the receptor, immediately there is an opening of the receptor. And from the opening, there is opening of specifically the chloride channel. Okay. Now what happens when the chloride channel opens? The chloride from outside the neuron will enter inside the neuron. So inside the neuron, you have a lot of chloride over here. Now we all know that chloride is negatively charged. All right. So the basic RMP, or the basic membrane potential of the neuron, as we know, is minus 90 millivolts. As more and more negatively charged ions, that is chloride, enter inside as the chloride channels keep opening when GABA attaches, this membrane potential will go more negative. Maybe it will become minus 110, minus 130 millivolts. Okay. So when it becomes so negative, we call it as the neuron is hyperpolarized. The neuron is hyperpolarized. Okay. Now, if the neuron is hyperpolarized, we all know whenever a cell is hyperpolarized, its action will reduce. Now, what is the action of a neuron? The action of a neuron is to fire signals. So if I depress or I hyperpolarize a neuron, it will stop firing the signals. Okay. If it stops firing the signals, what will happen? The brain will get depressed. And once the brain gets depressed, the person goes off to sleep. Very simple. I hope you all understood, because this is the basic of the mechanism of action of both benzodiazepines and barbiturates. Very, very sorry for the background noise. It is Ganpati in Mumbai, and that's why there's a lot of noise over here. All right. So going back, in very short summary, whenever GABA attaches to the site of attachment at the GABA receptor, it will lead to opening of the chloride channels. Chloride will move inside the neuron. It will hyperpolarize the neuron, and it will reduce the firing action of the signals of the neuron. So as a result of this, the neurons get inhibited and the patient goes off to sleep. Okay. Now, what happens when barbiturates attach to this site? Okay, now barbiturates come, you give barbiturates, suppose you give thiopentone to the patient, thiopentone will come and it will attach to its sites on the GABA receptor. Once it attaches to its site on the GABA receptor, again it will cause the same action as how GABA acts when it attaches to the receptor. So barbiturate will open this chloride channel, and it will cause the chloride to move inside the neuron, hyperpolarize the cell, and it will lead to stop in firing of the neurons. So as a result, the neurons are inhibited. Okay. So barbiturates have the exact same action as the GABA, and that is why they are called as GABA mimetic. Barbiturates are called as GABA mimetic. Now, when we look at the benzodiazepines, like midazolam, for example. So benzodiazepines, what they do is they will go and they will attach at their particular site on the GABA receptor. When they attach on their on their site on the GABA receptor, they will not cause opening of the chloride channels. What they do is they facilitate, they tell GABA, come on, more GABA should go and act on the GABA receptor, and this should lead to opening of the chloride channel. So what do you mean by this? For example, if you are a resident, what will you do if you are asked to do some work like barbiturate? You will open the chloride channel and you will do the work. Okay. But when you become a consultant or a head of department, what will you do? You will just sit in your chair and you will order the other residents. You will order the GABA resident and you will tell him, go and open the gate. You will not go yourself and open the gate. You will tell your resident, go and open the gate. Okay. So what will GABA do when benzodiazepine attaches to its receptor? More and more GABA acts on its receptor side,